Allow me to introduce myself as an Estradiol. And for this video, I will be talking about my autobiography. I am Estradiol, and I am a form of estrogen, which is a female sex hormone that regulates many processes in the body. I am used to treat menopause symptoms such as vaginal changes and hot flashes, and also to prevent osteoporosis or bone loss in menopausal women. And these are my available brand names. And my chemical name is like this. My therapeutic drug classifications are estrogen replacement and antineoplastic. Also, my pharmacological drug classification is estrogen. So, let's proceed to my pregnancy category. Well, I belong to pregnancy category X. And the mechanism of action goes like this. At the estrogen receptor, I am significantly more powerful than estrone and estradiol. As a result to that, various undesirable effects can be caused by higher concentrations of estrone in the postmenopausal population. In addition to sleeping problems, these effects may include hot flashes, chills, vaginal dryness, mood swings, and irregular menstruation. I function through binding to subtypes of estrogen receptors such as estrogen receptor alpha and estrogen receptor beta. In addition, I also exert potent agonism of G-protein coupled estrogen receptor, which is recognized as an important regulator for my rapid effects. I reaches to the nucleus of a target cell once the estrogen receptor is bind to its ligand, regulating gene transcription and messenger RNA formation. This mRNA makes contact with the ribosomes that creates a unique proteins and express my influence upon the target cell. Agonism of estrogen receptors improves post-estrogenic effects, contributing to the relief of vasomotor and urogenital symptoms of a postmenopausal condition. After an oral administration, I am well absorbed but substantially inactivated by the liver. The distribution occurs throughout the body, with the highest level of distribution appearing in fat. Steroidal estrogens, including me, are primarily metabolized in the liver, where we are conjugated with sulfate and glucuronide. Due to the rapid metabolism, there's no esterified forms of estrogen, including me, must usually be administered daily. My form of excretion or elimination is through the kidneys, through the form of sulfate and glucuronide conjugates. My indications involves the use for treating moderate vasomotor symptoms that is associated to menopause. Used to treat hypoestrogenism due to ovarian failure. Used to treat advanced androgen-dependent carcinoma of the prostate, but only for palliation. Also used to treat metastatic for men and women, and also breast cancer, but only for palliation. And used to prevent the risk of postmenopausal osteoporosis in women. And also, it is used for treating vaginal and vulvar symptoms that is associated with menopause.
And now, let's talk about my contraindication. I am not given to this following condition. Patient who has history of breast cancer, but except for those patients who are treated with metastatic disease. Patient who has history of pulmonary embolism and active deep vein thrombosis. Patient who are suspected for estrogen-dependent neoplasia. Patient who has history or present illness of stroke and myocardial infarction. Patient who has liver dysfunction. Patient who are hypersensitive to the ingredients. And lastly, patient who are suspected for pregnancy. And now, let us proceed for my side effects and adverse effects in different systems of the body. And now, let's first start in my adverse and side effects in the integumentary system. So, these are the following: hirsutism, loss of scalp hair, erythema nodosum, erythema multiforme, presence of melasma when drug is discontinued, hemorrhagic eruption, and rashes. And now let's proceed to my adverse and side effects in the skeletal system. Toothache happens. My effects in the nervous system are headache, migraine, dizziness, mental depression, mood disturbances, irritability, exacerbation of epilepsy, and dementia. My effects in the special senses are retinal vascular thrombosis, deepening of corneal curvature, and intolerance of contact lenses. My effects in the endocrine system is that it loses the sex drive and delayed ejaculation. My effects in the cardiovascular system are deep and superficial venous thrombosis, pulmonary embolism, thrombophlebitis, myocardial infarction, stroke, and increase in blood pressure. My effects in the lymphatic system is lymphedema. My effects in the digestive system are nausea and vomiting, abdominal cramps and bloating, cholestatic jaundice, increased incidence of gallbladder disease, and enlargement of hepatic hemangiomas. My effects in the urinary system are changes of vaginal bleeding pattern, breakthrough bleeding, spotting, and dysmenorrhea, increase in size of uterine, vaginitis, change in amount of cervical secretion, changes in cervical ectropion, and ovarian cancer. And lastly, my side effects in the reproductive system are changes in menstrual period, tenderness of the breast, enlargement of the breast, pain in the breast, nipple discharge, fibrocyclic changes in the breast, and breast cancer. So now, let's talk about the nursing responsibilities. So what are the nursing responsibilities before the medication? First, I should assess my patient if he or she has any allergy related to estrogens and tartrazine. Second, I should be aware for patients who are pregnant and lactating, patients who are undiagnosed for abnormal genital bleeding, patients who experience blood clot in the blood vessels, has bone disease, and renal deficiency. Third is that I should do physical assessment like identifying the skin color, edema, and lesion, providing breast, abdominal, and pelvic examination, doing renal function tests, glucose tolerance tests, and ensuring the collection of pap smear for history of patient's menstrual cycle. The fourth and last one is that I should orient my patient about the injection effect and reflexes. So now let's talk about the nursing responsibilities during the medication. So what are these? First, I should arrange the pretreatment and history assessment taken from the patient. Second is that I should give awareness to my patient about the estrogen use and telling my patient that she is not allowed to be pregnant while treating the disease. Third is that I should administer intervals in short-term when treating postmenopausal condition because it has a risk in endometrial neoplasm. Nurse must choose the lowest dose and must provide a drug-free week each month. Fourth is that when inserting a vaginal ring, it must be placed approximately upper one-third of the vagina and it will be remain in place for 3 months and will be evaluated for its continuous therapy. And when the vaginal ring will fall out within the range of 3 months, it must be washed with warm water and must insert it again. Fifth one is that when applying a transdermal system, it should be in the driest area of the skin, especially the abdomen, and it is not allowed in the breast and waistline because it can just remove the system off when rubbing the cloth. Sixth and the last one is that having a preparation of parenteral administration by using IM injection. It must be monitored and altered in order to prevent inflammation. So now we will proceed for the nursing responsibilities after medication. So what are these? First is that I should teach my patient about the drugs they are taking and preparing a calendar for drug day days, rest days, and a drug-free period. Second is that I should teach my patient how to apply vaginal cream and transdermal system and how to put a tablet in the vagina as its comfortable pace. Third is that I should monitor the side effects like nausea and vomiting, dizziness, headache, mental depression, loss of scalp hair, sensitivity to sunlight, bloating, redness of the face, and change in menstrual pattern. Fourth one is that conducting a medical examination to identify potentially serious side effects like cancer, blood clots, and liver problems. Fifth and the last one is that monitoring the pain in the calves of the legs, chest pain, abdominal pain, abnormal vaginal bleeding, lumps in the breast, numbness in the arm, change in vision, having a jaundice, and pain in the injection site. So those are the nursing responsibilities of before, during, and after medication. And that's it, guys. Those are my autobiography as an estradiol drug. We hope that it is helpful for you and you learned something from our discussion. And that's it for today, guys. See you on our next video.